We have a really special guest today. He's the director of bariatric medicine in Southern California for Kaiser. He's a great human being, a fantastic, phenomenal physician, Dr. Samir Murali. He did his undergrad. He's originally from Houston, Texas, and he did his undergrad at Rice University. Then did his medical school at UT Southwestern Medical Center in Dallas. That's where him and I became besties with our study group, the Hodin crew. And he went on to do his residency in internal medicine at UT Southwestern at Parkland County Hospital in Dallas. And then he did a Robert Wood Foundation, I think he did an MPH, Samir. And now he transitioned over to bariatric medicine for the Kaiser organization. And they have the largest bariatric program in the West, maybe the country. I'm not sure. We'll have him explain that. So everyone, welcome Dr. Samir Murali.
Thank you. What a generous introduction. My gosh. I think you gave me all kinds of titles and awards that I don't
deserve. You got the best student, the most phenomenal undergrad award.
Samir,
hey man, thanks for making time for us today. I think that you're obviously on the West Coast, and so I know it's an hour earlier, man. So we appreciate your time. And can you tell us what your official title is, and then what bariatric medicine is, and then why you think that's relevant to El Paso and the Southwest region. I know you know our region, so if you could tell us a little bit about that.
Yeah, so definitely thank you. And anytime you call me or text me like, "Hey, dude, are you up for this?" I'm gonna be like, "Yes." So I'm glad we're recording this live because I feel like things are more spontaneous. And with Dr. Maspons, things are always spontaneous. He texted me literally like 30 minutes before this interview. And we're on it.
And we're on it.
Yeah. So bariatric medicine. So what do? I'm the physician lead for the bariatric surgical program for Southern California Kaiser patients. And it's the largest bariatric surgical program in the world. We do almost 4,000 cases per year. We probably do more bariatric surgical cases in 1 year than the entire VA system for the United States would do in 10 years.
What is bariatric surgery?
Yeah, so bariatric surgery is any kind of surgery. It's a broad category. So bariatric surgery is any surgery where the intention is to help the patient lose weight. And so there are, about, three, you can say maybe four types of surgeries. There are several types of these operations, and they've started way back in the 50s, actually. But nowadays, the two big ones are the gastric bypass and the sleeve gastrectomy. And then there was the band, the lap band, and some people still think of all of these as lap band, but they're different. So the lap band is an actual band, an adjustable band that goes around your stomach, and then it's adjusted. The amount of saline is adjusted. The tightness of it is adjusted with a port that's right under your skin, and then there's a connection. So the salt water goes into that port and expands and contracts. We usually don't like doing that anymore because having a foreign body inside having something that's not part of you, that's inside of you, usually causes problems in the long run. So about half of those bands actually have to come out within 10 years. So my role is, I'm not a surgeon, right? So in your introduction, you said I did internal medicine, but it's basically, my role is really, as a physician, my clinical work is taking care of patients both before and after those operations. And then I also do medical weight management. So I'm an obesity medicine board certified doctor. So I can help my patients or patients who are referred to me, help them lose weight with medications or just with counseling and that kind of thing. Most of my patients who are not surgical candidates either have a significant amount of weight to lose, but for whatever reason surgery might be too dangerous for them, or they have lots of medical conditions like diabetes, heart disease, high blood pressure, or problems with their joints, where weight loss would really help improve their health. So it's not just, oh, hey, I got this wedding coming up in 3 months and I need to lose weight. Those are not.
That's what happens. So like people when they find out I'm a gastroenterologist, they're like, well, who's a good weight loss surgeon guy that I can go to, because I want to go next week.
Yeah.
To just show up. And I know a lot of people who get surgeries like that. And I'm not here to talk mess about surgeons. I'm not here to talk mess about this whole process. I think it's really important that you kind of that you talk about what you do, just because I want people here in El Paso to understand, or to just kind of learn about that it's complicated, right? Like anything in life, the if you want real stuff, if you want real results, you got to put in the work, and it's not a quick fix. So can you tell us just about like the kind of people that you see in your and why that kind of relates to El Paso specifically?
Yeah, So, the kind of patients, most of the patients, so I work, my office is in San Bernardino County, and probably maybe 60% of my patients are Latino. Maybe about 5 to 10% speak Spanish, or only Spanish speakers. And so, but how does it relate to El Paso? Well, I think obviously there's a cultural connection when you talk about people from Latin America, and by and large most of the patient population, most of the Latin population that we treat have their origins in Mexico, some in Central America, other places, but mostly Mexico, Guadalajara, those types of places. And obviously there's a connection with El Paso there because of the proximity. But in terms of bariatric surgery in general, I'll just kind of cover that topic and kind of put a cap on that, and then kind of go into the cultural aspects of obesity that I feel like are really important, that I observe. So like you said, there's no quick fix, and nobody's surgeon bashing or anything like that. I work with surgeons all the time. They're my close colleagues. But it's important if you're thinking about bariatric surgery, and because we are close to the border, in Southern California, you are obviously right on the border. We have people who can go to TJ and get surgery. You have people who can go down to Juarez and get surgery. And it's probably a tenth of the cost usually when you do that. The thing is it's important to think about weight is not like, it's like this thing you just got to remove, like, or just kind of like cut it off or something. The weight is almost like, it's like your temperature. It's like fever. If somebody has a fever, you really want to know, where's that coming from? Is it COVID? Is it tuberculosis? Does somebody have leukemia? What's going on, right? The purpose is not just to give somebody Tylenol and lower the fever and then they're better, right? Yeah. That doesn't work. You actually have to treat the underlying cause. So when a person is gaining weight, especially significant amounts of weight, surgery is something, it's a tool, right? So it's kind of like the Tylenol. It's going to help you feel better for a while, so that you can kind of work on whatever's going on in you. But it's not a fix. It's not something that's fixing something if you're not participating in that. And so the best similar kind of process you could think about would be like maybe getting an organ transplant. Right? If you have a kidney that's totally failed, liver's totally failed, you need a transplant. Well, you're going to be a part of this process to prepare you for that, right? Yeah. And then you get your transplant, and then after the transplant, your life is totally different. You have to really take care of that organ. You have to change your life. If you gained weight and like got a liver cirrhosis because of fatty liver or from alcohol or some other thing, and your behavior was part of that, well, then your behavior after the surgery has to be different so that doesn't happen again, or with your kidney or whatever. Or another analogous situation would be like transgender care, right? Not all transgender people get surgery, but some do, and so there's this whole psychological evaluation process, and like, even hormones and things like that. And then they get their operation, whether it's, something from the waist up only or the whole thing. And then their life is totally different. Right. Yeah. And so, you got to think about bariatric surgery in that context. And if you think about it, if you look into the numbers, really only like 1 to 2% of people, like our population, they have insurance, they have coverage for this service, right? So only about 2% of covered, Kaiser Permanente covered individuals who are eligible for surgery actually choose surgery as an option. And I feel like a lot of that has to do with just reluctance to be like, well, I'm gonna have to really change this and that and all this other stuff, and I'm not ready for that kind of change. And that's good. It's good to know yourself. Otherwise, it's really hard to make those kinds of changes. And some people are scared of surgery, and that's normal too. It's a scary thing.
So you said that you had like the highest numbers, the largest bariatric program in the world.
Yeah.
Does that mean that just means patients or people in your program, but not necessarily surgeries, or does that mean surgeries too?
It's both, actually. So Kaiser is an HMO, and so like it's like a little integrated, it's like a bubble, yeah. Like, right. So all the primary care, the hospitals, the specialists, we're all part of the same network. And people who are outside of the network cannot see our doctors and get the services from us. And so it's this very kind of bubble type of population. And so we have maybe almost 50,000 patients who've already received bariatric surgery in our area. And then we probably do the most cases on an annual basis than any single practice in the world.
Yeah, I mean, you guys are really unique because you see you and your organization see the utility of weight loss and really go after, whether it's surgery or not. You're not necessarily, I guess the driver is different, right? You're not doing procedures to make money. You're doing procedures to save money, or doing the program to save money down the line, because you know that people who lose weight are going to be healthier people down the line.
Yeah,
essentially, right? That's the driver.
Right. So I mean, the Kaiser model is so actually I don't work for Kaiser. I work for Southern California Permanente Medical Group, and Kaiser Permanente exclusively contracts with my medical group.
Yeah.
And so Kaiser pays the medical group up front, to cover all the patients for the whole year. And so the doctors and the medical group are bearing the risk. So if we don't get paid for every service we provide, we get paid up front. And so if we waste that money, then the profitability of our organization goes down. And so the way that model works is we're invested in keeping our patients healthy, because the healthier they are, the more financially healthy our organization is. And that's a kind of a nice way to practice medicine. You don't have to necessarily bother with all of the, did I code,
yeah, man,
trying to make profit off of illness, really.
My philosophy as a physician, and I think this is kind of why, one of the reasons why I think we're close friends, is that like my goal is always to try to put myself out of business. That, like if I'm doing a good job of curing people, then at one point in my life, I'm going to have 0 patients, which will probably never happen, but that's at least what I'm trying to do.
Yeah, no, that's I think that's the right way to practice. Now, now connecting this with El Paso and the Latin population, the Latinx population, what I see in terms of as a non-Latin person, like my family's from India, but you and I have talked about this a lot.
This whole time,
in terms of the similarity, there's lots of similarity in cultures and stuff. So one thing that I've noticed, so Mexico is probably I think the number one most has the largest obese population in the world currently, and that happened relatively recently. And what you see in Mexico is the drivers of that is there's a shift into urbanization of the country, more processed foods and more sugar sweetened beverages and that kind of thing. And that's happening in Mexico. What happens, I feel like, in the Southwest and in Latin cultures is people really work hard. I mean, they work really, really hard. And a lot of times my patients are folks people who work nights. You know, they work long hours. They have very kind of they're not people who can like socially distance, you know, or necessarily even take time off of work. And so what you find is obesity really tracks with time and how much time you have for yourself. If you don't have time for yourself, a lack of time is most likely going to translate into weight gain. So when I'm taking a weight history, really what I'm doing is I'm trying to take the inventory of how much time you have to take care of yourself. And there are levels to that. One is, first of all, are you a priority? Because if you don't make yourself a priority, you're not going to make time for yourself. And what you see a lot of times, maybe 80% of my population is women. A lot of, especially Latin women, they don't make time for themselves. It's everybody else. It's like, well, if everybody else is happy, then I'm happy. And that works to a point, you know, and that breaking point is when you start getting diabetes and your knees start hurting, your back starts hurting, and all this other stuff. And then it's like, I can't serve everybody all the time anymore. And then you're forced to kind of be like, oh my gosh, what's going on with me now? Right. So I see that a lot. It's a real challenge to get people to say, it's okay to focus on yourself. Yeah. You know, it's all right. You're not a bad person if you're going to say, you know what, I can't do that. I cannot make that social gathering.
So what's the magic then? There's a couple of Facebook comments that I want to get to, but sure. What's the magic in making time for yourself?
So the magic, I guess
it's not magic.
I would say the number one piece of magic is, I don't know, I can't say number one, depends on the person. But I would say the first most important thing is your sleep. Whatever you're going to do to be healthy, you're going to be doing it while you're awake. And if you're not sleeping well, then the time you do have is not going to be used efficiently.
Not quality.
Not quality time, yeah. And so you do have to, you know, for me, for example, I know that I need somewhere between 6 and 7 hours of sleep. That doesn't mean 6 hours of like, I went to bed and then I woke up in 6 hours, because you don't always immediately fall asleep, you know? So you want to give yourself at least a half hour. Most people probably maybe fall asleep in 10 to 20 minutes. But you want to give yourself some buffer. So I try to set 7 hours for myself to sleep. And if you don't do that, yeah, I mean, you're gonna mess up your whole, like, this daylight savings thing now. I mean, it's gonna happen. I wish they would get rid of the whole thing. Like,
I know.
I mean,
you know, the sleep thing is really important because, so for me, people comment all the time that I look really tired. That's just the way I look, I think. But I fall asleep right away, and I think that's the issue, is that I'm tired. And I think those 30 minutes, if you are taking time to kind of that 30-minute wind down, and then fall asleep, I think it's a good sign that you're kind of you're at a steady energy expenditure or whatever, or usage during the day, and appropriately going mimis at nighttime. Yeah.
So I mean, like, so you talk about winding down. That's really important, right? So winding down and having a set bedtime is really important, because you're training yourself. You're training your body to respond in a certain way. And that's why I really dislike daylight savings time, because it throws everybody off an hour. And actually, it's measurable. Like, heart attacks and strokes increase, like, overnight. Tomorrow, there'll be 20% more people having a heart attack or stroke because of daylight savings time, you know? When you lose this,
because these cortisol pushes or something.
Yeah. And it's well known. So anyway, but I don't know. It's a stupid thing. So the first thing I would say is, and this is, people are going to have a hard time with this, but you have to turn the devices off. Yeah. At least 30 to 60 minutes before going to bed, because there's a blue light, and some of the devices have tried to do this night shift thing where it blocks the blue light and all that stuff. That may be okay, but turning the devices off. Sorry, you can hear my dog.
That's fine. That's fine.
Kind of sneezing in the background. Anyway, but turning it off is not just about the blue light. It's about just turning off closing that part of your day, your email, whatever, because whatever you're interacting with, it's making your mind go, 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 go. So turning the devices off. Some people might take a warm shower, because cooling your body releases more melatonin in your brain. And then actually turning off the bright overhead lights, maybe just using lamps, for example. Yeah. All these things are important, because falling asleep is like surfing. Your melatonin will surge, and if you don't catch that wave and it goes down, like you and I might, you might remember this when we were in training. You would feel really tired at between 1 and 3, and then after that, you're just like delirious. You're just like,
it's the worst. I remember you and I used to study standing up, walking around the apartment or the library, so we would fall asleep. And then there's this whole thing, and I think this goes back to your comment about the people you work with. They work a lot of hours, and they're not spending time with themselves. Is that there's a lot of people who do night shifts, and like I think. We had that rule in med school, right? Like an hour, a shower's worth an hour or something.
Something like that, yeah.
So and eating too. I think also there's got to be some kind of correlation with like eating at night that kind of wakes you up too.
Yeah. So that's related to insulin resistance. So you're more insulin resistant when you are at night than during the day, and so. Basically insulin, most people know insulin as this thing that reduces your blood sugar, right? This hormone that releases from your pancreas reduces your blood sugar. The other thing that insulin does is it's a fat storage hormone, right? So the extra glucose that's not used for energy, the extra sugar that's not used for energy, insulin basically is the signal that tells your body to store that as fat, right? So people who are diabetic or pre-diabetic, they're always going to have a harder time losing weight for the same amount of calories and the same amount of exercise as somebody who doesn't have diabetes or pre-diabetes. People with diabetes or pre-diabetes, it's going to be harder for them to actually lose weight. Their blood sugar control will get better before they lose weight. And so this shifting between night and day, people who work nights, for example, they'll do their work week working nights, and then they'll switch. They'll do like daylight savings on steroids. Yeah. They'll switch to being up during the day so they can hang out with their family. Yes. And then they'll switch back, right? So that switching forward and switching back, there's this long period where you're not sleeping at all, like more than 20 hours, for example. Yeah. And there are really good studies in the UK that show that shift workers, they call them shift workers, they have higher prevalence of diabetes and heart disease and all these things. So you take this daylight savings effect and you inject that into someone's life on a weekly basis. What's going to happen? What's going to happen? But when you talk to people who do these types of jobs, they're getting benefits. They're getting, and this is the social part, right? The social part is when you have situations where people don't have free and fair access to healthcare, for example, they're tied down into certain jobs because of those benefits. They don't have the freedom to kind of find their niche and find their work-life balance because they have to have this job for these benefits, and so that's where you see the social problems, social determinants of health bleed into the medical, which we saw tons of when we were in training, in Parkland, for example. Yeah. One of the main reasons why I do the work that I do, actually.
So I want there's a couple comments that people have. I want to try to get to some of those comments.
Sure.
So Jesus Pons Gardner, thank you for watching, Jesus. So she wants to know about intermittent fasting versus gastric bypass, and then she also wants to know about extreme weight loss, like losing more than 100 pounds in a year. Thanks, Jesus, for tuning in to watch us.
Yes. So thank you for that question. Those are good questions. So first, I would say intermittent fasting versus bariatric surgery. The first thing to know about bariatric surgery is the way you should think about weight loss things in general. Okay, is they're kind of like intensities, right? So if you think about somebody who has kidney problems, right? So first, you might control their blood pressure with dietary changes, like don't eat so much salt, whatever, stuff like that, right? And the next is, well, your blood pressure is still too high, the salt thing didn't work. Let's actually give you some medicine for that, and that'll help you lower your blood pressure, right? Which will help your kidney. Now, let's say your kidney gets super, super damaged, and at some point it doesn't work anymore. Well, the dietary change and the medicine is not going to work. That's when you need dialysis or a kidney transplant or something, right? And so bariatric surgery, you should think about it in the same way. So like intermittent fasting, for example, we wouldn't think about that in the same way as bariatric surgery. Although both of these things can help you lose weight, bariatric surgery is really for people who have probably are more than maybe 50 pounds overweight or so. So their body mass index, and you can calculate that, would be 40 or higher. And so you can just Google BMI calculator, and then you can figure out your own BMI based on your height and your weight. Or if the body mass index is 35 and you have some medical problem related to your weight, like diabetes, high blood pressure, heart disease, things like that, those people are also eligible for surgery. And so surgery is going to help you lose weight. About 20 to 25% of whatever you weigh on the day of surgery, you take that weight. So say you weigh 300 pounds, 20 to 25% reduction of that. So 20% of that is 60 pounds. 25% of that is 75 pounds. So at 5 years later, you should expect that you would have lost roughly between 60 to 75 pounds. You would probably lose more than that initially, but the weight gradually goes up after about 5 years. It keeps going up, and then if you don't control it, it can keep going up. Now, intermittent fasting, any kind of non-surgical thing or dietary thing, or even medications, we usually only expect maybe 5 to 10% weight loss with those types of things. Now, people can lose more, for sure. People can definitely lose more, but usually we think maybe about 5 to 10% is what most people will lose with those types of things. The difference between bariatric surgery and anything else usually is the durability. So bariatric surgery, because it's a surgery, most people are maintaining a significant amount of weight loss long term. And that's probably the most important thing about any weight loss thing is, as a bariatric medicine or an obesity medicine doctor, I really don't care about how much weight you can lose. I care about how much weight loss you can actually maintain. And then the other thing is, I don't really care about weight loss. I care about fat loss, right? So with intermittent fasting, if you do it incorrectly, you can lose a lot of muscle, right? And so that's what people don't realize is when they're losing weight, they're like, I'm losing weight. This is great. But when you lose weight, maybe as much as 25 to 30% of that weight can be muscle and bone, because when your body weighs less, you don't need as much muscle mass to carry it around. If you weigh 300 pounds and then now you weigh 200 pounds, that's 100 pounds less weight that your body has to carry around. And so the muscle mass and the bone density goes down.
So why is fat important? Like why would, I remember, I think we're in med school, man. There was some physician I think you were working with who studies the belt, right? Like this whole waist ratio and the hip to waist ratio.
That might have been Dr. Abate, Nicola Abate. He's an endocrinologist, probably still is. I hope he's still practicing.
But so like, what's the importance basically of losing fat, and how can you tell like that you're losing fat and nothing else?
So, I'll just answer the second part of her question quickly. The 100-pound weight loss, it depends on where you start, right? If you're starting at 200 pounds, you lose 100 pounds, that's not good, right? Weight loss, the way you do it is really, really important. And so rapid, quick, large amounts of weight loss, generally, my feeling is that is usually not sustainable. There is some evidence there that says it's okay to do that, but I think really what you want to do is something that's sustainable, right? So if whatever you're going to do, you need to start it with the mindset that I'm going to do this and I'm going to do this for the rest of my life. And if you feel like you're not able to do that, then I would say don't do it. With intermittent fasting, I usually will actually have my patients on a 10-hour window, because that feels kind of natural still to people. So there's a, somewhere between, let's say 8 o'clock in the morning, and then 10 hours after that would be, what is that? 6 p.m. So starting at 8 p.m. and stopping at 6 p.m. So something like that. So that's how I apply it. It's more like time restricted feeding. Fat. Why is fat not the best? Fat has a role. Definitely, fat has a role in our bodies to play. The most significant role is that it obviously stores energy, but our fat cells produce a lot of hormones. It's almost like more than 20 different proteins and hormones that they produce. When does fat become dangerous? When it gets outside of the fat cell. So if you imagine, some people, for example, my dad has diabetes. He doesn't look overweight or obese, right? You met my dad. But there are some people who are, there's some people who are much, much bigger, right? Who don't have diabetes, right? Who don't have high blood pressure.
Yeah.
So what's up with that? And the difference there is where the fat is being located. And that probably has to do with genetics. So take this cup, for example. So I have this cup. This is what, 24 fluid ounces or 20 fluid ounces, 22. So imagine a little shot glass here, okay? So my dad, in terms of the amount of fat his fat cells will store, is probably more like a shot glass. But someone who's really big, who doesn't have diabetes, the amount of fat that their fat cells can store is much larger, right? So the number of fat cells may be the same, but the actual quantity of fat that each fat cell can store will be different, and that's going to be most likely genetically determined, okay? So my dad's fat cells are not that healthy. They don't really store very, very much fat. And so consequently, my fat cells are probably similar to that. But this other person's fat cells are very healthy, and they can store lots and lots of fat. And why is that important? Because when my fat cells or my dad's fat cells say they're full, the body looks at energy like cash, right? If you found $10 million in a briefcase, right, and you took it to the bank and you want to put all that money in the bank, the bank's going to say, well, we can accept only $10,000 in cash deposits. Everything else you're going to have to declare, and then half of it's going to the IRS. So are you just gonna leave the briefcase on the sidewalk? Dr. Maspons, are you gonna leave it on the sidewalk? No, I know you won't. You're gonna put it in your mattress. You're gonna find something.
Donate it.
Sure. Right? So you want to keep it. So the same way, calories and glucose are the currency of the human body, right? So when you feed your body more calories than it actually needs in this moment, it's not going to be like, oh, let's just poop it out. No, it's not going to do that. It's going to store it. And it's going to first go to the bank and try to put it in a savings account. And then if the bank account says we can't accept any more deposits, it's going to store it somewhere else. Where else does it go? It'll go into the liver cells, which is why you see fatty liver, right? It can even go in the muscle cells. It can go around the blood vessels. It can go in your heart muscle. And so this is what we call ectopic fat, or basically fat that's being stored in a place where it doesn't belong. It's like if the garbage man doesn't come anymore to pick up your garbage, what are you gonna do with all the trash? Yeah. Right? It's gonna be lying around your house.
So this is kind of like people, you know, sort of like I want the physicians to give advice as if they were talking to their you know, their family at the dinner table. And all the time I always hear stories, like my mom always tells me, like, you know, like, oh, you know, so and so died and he was skinny. You know?
I can see your mom saying that.
Yeah, he's like, se murió Sotano y estaba flaco. Y comía bien. You know, so, but it's like this whole like skinny fat thing, right? Where they like, well, maybe he could have died 10 years ago, but just because he ate a little bit better, then maybe he ate like some spinach every day. Maybe that saved him an extra year or something like that. But so, what would you say to if you're at our house, you know, like, so you're coming to visit us, and my tios and my tias are asking you questions, like, well, you're like, how do I lose weight? And it's everything, right? That's like the most annoying question probably you get, right? Like, because everybody wants to like take this.
Yeah, and you know what? While they ask me the question, your mom's gonna be feeding me tacos and be like, "Oh, I made this for you. I made that for you. Eat this, eat this, eat this." Right? And how do I lose weight? Oh man, you know, it's like my patients deal with that all the time, right? Especially my patients who get bariatric surgery, who you know, are of Latin origin, because they have family gatherings like every weekend, you know, and there's this culture of being polite, you know, and being respectful, and food is being like the kind of the way that love is shown and stuff like that.
If you don't eat their food, you don't love me.
Man, it's really hard. You know, it's really hard for these some of my patients to navigate that. I'm trying to be healthy, but I still want to show you that I love you and not offend you, and we're all here together. And that's where, you know, families. I mean, families are very powerful, and they can be a powerful force for health, but they can also be a powerful force for other stuff.
Yeah,
right?
For sure.
So, and that's where I feel like culture is really, really helpful, in the sense that culture can really uplift us more so than health insurance or, you know, housing or whatever. Our culture, if we apply it properly, can make us very, very healthy. And there are places like this all over the world. You know, they're called blue zones, where people live to 100 and more because of the culture, right? And so the beauty of connectedness and how that can transmit health and wellness to other people, that's really, I think, more important than anything you and I have studied, to be honest. But if we're sitting around and they're like, oh, how do I lose weight? You know, I think they're probably like 6 questions that I would ask. You know, the first and foremost would be like, tell me about your sleep. You know, are you satisfied with your sleep? That's kind of how I ask that question. And a lot of people will that's where the conversation sometimes, probably majority of people, that's where the conversation's like, oh yeah, I can't sleep, I wake up multiple times, I keep going to the bathroom, you know, all this stuff. And that's where, if your sleep is messed up, forget about weight loss. Okay, so think about sleep apnea, think about stress, think about other things, because just that question about sleep can guide you into so many places where their health and wellness behaviors may be broken. The second most important thing, I think, is really getting into, what are you drinking? Are you drinking, you know, my patients love their licuados. You know, they put the pepino and the piña and the chia and the ginger and like all this stuff. I'm like, whoa. And there's like, oh, you know, it's green. It's all green, you know? And it's like, well, yeah, it's green, but you put all this pineapple and papaya and like apple in there too. And when you're drinking sugar, even if it's natural, even if you use honey, even if you use agave, right?
Yeah,
if you drink sugar, that's the fastest way. That's like picking up that $10 million briefcase, right? So
because of an insulin surge, is that what happens when you start storing?
Yeah. So if you drink carrot juice, or you puree the carrot, or compared to boiling the carrot, eating the carrot, compared to eating it raw, the glucose spike, how quickly the sugar gets into your bloodstream is going to be lower and lower as you go down. So drinking carrot juice is the fastest, like injecting, right? So if a diabetic is having low blood sugar, what do? You don't give them a shot. You just give them some juice, right? And they feel better. That's how quickly it gets into your bloodstream, right? So if you're going to mainline sugar into your body, the body doesn't need that much energy all at once. And so what's it going to do? It's going to go straight into fat, right? So this is one of the main reasons why countries that have lots and lots of obesity, it's not about really what they're eating, it's what they're drinking,
amazingly, so we're definitely a juice culture, right? That's just what it is. But what I always find fascinating is that, so number one, Latinos live for a long time, right? There's like, we have like abuelitas who are celebrating 100 years old or 105. Like my grandma's like 97 or something.
Yeah.
And so like, and the food by itself necessarily hasn't changed, but I feel that the makeup of the food has changed.
Yeah.
So like, and there is some commodities. I think like there's definitely like foods that maybe like 100 years ago we didn't have, and maybe people aren't taking the time to cook fresh and that kind of stuff. But like the core food, I guess we'll have to look at a little bit more history. Maybe there needs to be a little bit more food history on this. But like,
what you're talking about is the cocainification of food, man.
Yeah.
I mean, like the Incas would chew on the coca leaf. It's almost like their coffee, right? They would chew on it, and they would plow the field, right? Give them a little bit of a kick, give them some energy. But when you ultra process that leaf and you make fine powder cocaine, right? And then you sniff it or you inject it or whatever, it's gonna do crazy things to your brain, right? So like, there's no donut treat, there's no like helada tree or whatever. Like you can't like that, right? I mean, like all this stuff is unnatural, and you can do it in moderation, right? So one of the things we don't want to do, and as doctors we do this a lot, and it's really important we don't do this very much, is to not tell people, don't do that. You don't do it, right? Because the moment I'm doing, so if I'm doing this, I'm talking to you and I'm saying, hey, Aldo, you're a great guy. I really like you. You just need to keep doing what you're doing and everything will be great. And just by the way, if you could just get a little more sleep, things will be better. Like, you can't focus on what I'm saying when I'm doing this, right? I mean, it's like, you get defensive. The reaction, the natural human reaction is when you tell your daughter, oh, don't date that guy. I want you to stay away from him. You and I should never say that to our daughters, right? Because the first thing she's gonna do, what is she gonna do? You're like, right? So that's the human mind. And so you tell people, don't drink this, don't do that. They'll try to follow your advice, right? They'll try to follow your advice and they'll say, stay away, stay away, stay away. But that desire is in their mind. And then it's like trying to not think about a pink elephant. And eventually they'll regress back to it. And so the better thing to do is not talk about, so when I talk about sugar sweetened beverages, I do tell my patient, look, it's really important you try to avoid it, try to find some alternatives. But I also want them to think about, what can you do more of, right? Maybe you can drink more water. Maybe you can drink more of this non-sugary thing. So if you think about what I'm going to do more of, not what I have to restrict and what I have to do less of, it's a different, you always want more, right? We live in the United States. We want more. We want more of everything from Texas, So when you think I want more of this, it's just kind of you think about it in a little more positive way, and it's more likely that you're going to be able to kind of incrementally go towards it as opposed to try to do all or nothing.
So you had, all right, so the dinner table, you're asking about sleep, you're asking about sugar sweetened beverages or anything that's sweet to drink. What are the other ones?
So then stress is a big one. A lot of my patients, stress out about work and financial security. My extended family is all the way back in India, right? So that's where I think culturally maybe there's a big difference between my culture being an immigrant here versus immigrants from Mexico or other places, because a lot of their families are close by, like really close by. And some problem that's happening in the extended family, it really affects, it's like this domino effect that people really stress out about what's happening, and rightfully so, about their family members. But it's not just immediate family, it's like the whole thing, the whole network. And so family stress is a really big one. But I think financial stress is oftentimes a major thing that will drive people to cope with eating. And sometimes when they have less time, right, they don't have the luxury of being able to prepare things, or if they're stressed out, they're not going to be thinking, when you're stressed out, you're not going to be like, let's prepare this wonderful salad and let's cut up all these vegetables and let's cook a lot of food. A lot of people are just going like, man, I'm stressed out, I just want to go get something, and that kind of thing. So sleep, the sugar, and even alcohol has more calories per gram than sugar. So beer and all that stuff.
Because alcohol is a sugar, and I think people don't realize that alcohol is a sugar too.
Yeah. So the way that sugar, like Coke and beer, can both cause cirrhosis, because both of those will cause fat to be deposited in your liver, right? Yeah. And so the most common, actually probably leading cause of liver, you probably know this also, of cirrhosis in the United States at this point now is fatty liver, not from alcohol.
Yeah, it's a topic. I mean, that's my opening line with my patients. Well, not opening line, but it's the number one cause for liver transplants in the United States is fatty liver disease. And the kids that I take care of, I'm telling them, they have old man problems. Guys, and the other thing is, like, one of the advice that I give them is, like, we're talking about all the things to avoid, or drinking more water, etc. But this is a family decision. It's not just right for Juanito to be the guy taking all the sacrifice. The whole family has to make changes, because the family is the powerful influence.
Yeah, family is huge, right? So money and family, those two things can be the biggest stressors that people face. And through money, it's really kind of like work, money, that combination, and then family. So stress. The next thing I would ask about is physical activity. Are you being physically active? Not because being physically active causes weight loss. This is important. What you eat is probably 5 times more impactful on your actual amount of fat on your body. But being active, it makes you feel more positive, actually, right? So you're probably more likely to eat healthier than when you're exercising. And exercise is just really good, overall for the human body. We're not actually meant to be sitting down and kind of in front of computers and all that stuff. Our body wasn't designed for that. And so when I talk about exercise, I'm not asking them to buy a Peloton, you get a gym membership or any of these things. It's just just do a little bit more. Again, can you do something more, right? And just kind of keeping maybe you go for a 5-minute walk and you just say, every day I'm going to walk and make it small, really small. Like I'm going to walk for 2 minutes, right? That's, Dr. Murali, that's stupid. Why would I only walk for 2 minutes? Because if you can do that 2 minutes every day, maybe tomorrow you have a little more time, you'll do 5 minutes because you felt good about it, right? So what's really important about changing behavior is not the actual behavior you're doing, but feeling successful, right? Before we got on, you were like, dude, man, when I go to sleep late and it throws my sleep off and it takes so much time to get back on, if you're feeling like a failure because, oh, I didn't go to bed on time and I didn't get enough sleep, that feeling of failure is more impactful than how much sleep or how much, the amount of sleep you actually got. So if I made a goal, I'm going to exercise for an hour a day, and then I do it for 3 days, and then I don't do it for the fourth day, I'm going to feel like a failure, and I might not try to get back on the saddle, right? So keeping your goal really, really small, but staying consistent with it, right? Staying consistent with it. You're consistently doing that 2-minute walk. In a year, 2 years, 3 years, 4 years, that person, because they stay consistent, is probably going to end up doing more exercise than the person who said, I'm going to exercise for an hour a day, because they're consistently doing it and they feel successful doing it. The other thing would be planning your meals. So one common question I ask my patients is, do you know what you're going to have for lunch and dinner tomorrow? Right? So if you don't know what you're going to eat for lunch and dinner tomorrow, chances are this week you're probably, if your goal is to lose weight, like maybe a half a pound or a pound a week, which I think is healthy weight loss, you're probably not going to lose weight this week if you're not consistently planning out what you're going to be eating. Because
so avoiding this whole spur of the moment thing.
Just because disorganized eating most of the time is going to devolve into convenience food. Like, oh, I'm going to grab this. Oh, what do we have? Oh, I'm really hungry, right? So in the moment when you're really hungry, that's when you're least likely to make a rational choice. You should not make financial decisions when you're hungry. You should not make relationship decisions when you're hungry. You should definitely not make food decisions when you're hungry, right? There's a saying.
Wars have been started because people are hungry.
Right? A hungry man is an angry man.
Yeah.
Or woman. And then the last thing is vegetables. So the lunch and dinner that you do eat is 50% vegetable, is more than half vegetable or less than half coming from a vegetable. And when I say vegetable, I don't mean French fries. But because vegetables, first of all, have a lot of nutrients in them. But second of all, they have weight to them, right? So they have water in them and they have fiber, and these things make us feel full. And so when you're trying to lose weight, you don't just like kind of make your plate into this microscopic, like small portions. You can have large, healthy portions of food, especially if a lot of it comes from vegetables. So there's lots and lots of evidence. People start doing plant-based and all this other stuff. I don't say, oh, everybody do plant-based, because again, going this all or nothing thing, that doesn't work, right? You need to do something that's right for you, that feels consistent, that you can do. But I do recommend that when you're eating, half of the meal really should consist of vegetables. So
like recapping, I think, so your dinner table, you're like, hey, how's your sleep?
Yeah.
What do you drink? What are you drinking? How's your stress level?
Yep.
And more vegetables.
Physical activity.
Exercise. And I think am I missing one?
Planning. And then the
planning.
Mm-hmm, yeah.
And so if people want to learn a little bit more about your topics, you have a YouTube channel that's really awesome. What's your YouTube channel?
Yes, that's right. It's called Dr. Murali Weighs In. That's all DrMurali weighs in, like WEIGHS weighs in. So I probably have maybe 10 videos now. I'm trying to ramp up. I'm going to be putting out one, probably be done editing it this week, about getting back on track. A lot of people have gained weight during pandemic and quarantine and things like that. So how do you get back on track? That's going to be the topic of the next video.
Thanks, Samir. Two things, man. How important do you think? So, like, if let's say you were somehow magically able to check in on all of your patients, all 50,000 patients, once a week or once a month or something, what do you think the success rate? Do you think that's your patients would have a better success rate than a doctor who doesn't check in regularly with their patients?
I think if my patients checked in with each other, they would have a much more successful success rate. And that's kind of this idea of cultural norms being something that really changes behavior.
We're talking with Dr. Samir Murali. He's the director of bariatric medicine of Kaiser Permanente Group. We're sponsored here by beMeDoc. We're a mobile health app. We're improving the medical outcomes of our community. We're a local tech company here in El Paso, Texas, and we're expanding to Texas and New Mexico. And we're broadcasting live from Maspons Pediatric Gastro. And we're talking about Dr. Samir Murali regarding just kind of checking in. It's kind of there's studies to suggest this, and I just kind of want to get your take on this. But like if you have an outcome that you're trying to improve, if I don't see my patients for 6 months or once every 6 to 12 months, versus patients that I see on a more regular basis, they're going to do, the patients I see more regularly are going to do a lot better than the patients I don't see as regularly.
Yeah, and that's just this idea of accountability, right?
Yes.
So some people really respond well to professional accountability, and I feel like the less kind of Americanized patient, I feel like the patients that I have who've really recently immigrated or things like that, they really value the doctor's opinion. You know, it's like they're like super like this. Their greeting to me is like so long, and I get all these blessings at the end of the visit. Right. And they really like, so that kind of patient is really very invested in what the doctor says, right? And there's some other, some cultures just culturally are very respectful of, kind of a person who's been educated and that kind of thing.
Sure.
And so I definitely do see that a lot in my Latin patients. And so I try to check in with them, on a monthly basis. It's really hard. But even if it's something quick, but through like telemedicine and things like that, you can send your patient a message, right? Yes. You can check in with them in a personal way that doesn't necessarily have to be a full visit. So virtual medicine, telemedicine has completely revolutionized the way we do this, and it's amazing because they check in with the patient. If it's a video, I can actually see what's in their fridge. I can see what's in their pantry. Which I never was able to do before.
I think it's been one of the nice things about this whole telemedicine revolution has been I can understand my patients in a little bit in a deeper level because I'm seeing like maybe there's 20 kids or like there's a bunch of families in a house, and you can see that there's maybe some stress or maybe like it's been really nice. It's been a really nice connection.
Yeah, you can see how they organize their medicines. You can see. I mean, that's. The problems we have nowadays are not infectious diarrhea and tuberculosis and malaria and these types of things. Yeah, we got COVID, right? But even COVID, right? So I have a video on COVID and obesity, and why is it that people who are overweight or obese have worse outcomes with COVID? We actually published a study. I was the senior author on a study that showed that when your body mass index is 40 or higher, your risk of dying from coronavirus is 200 to 400 times higher than somebody who has normal weight. So,
and that's one of the reasons why I think in the Latino community and minority communities in the United States, we took higher hits in terms of there's been more deaths in our communities because of that reason. Right?
Yeah. So it has to do with that same concept of fat being in your liver and your muscles and all these other places. When that happens, it causes insulin resistance, which causes diabetes, but it also spins off a cascade of inflammation, right? And so if you imagine that inflammation as like this smoldering fire, like if you had a campfire and you let it die down and all the coals are there, right? So that's what this type of obesity, the person with the little shot glass that has fat in the liver and all these other places, or someone who's really big and has then exceeded their fat storage capacity and then has developed that same overflow effect, right? So, you can have the big glass, but then if you keep gaining weight, it can overflow, and that overflow is going to go into those places. So that causes inflammation, and COVID the way that COVID works and the receptors that it binds to, it's like pouring kerosene or gasoline on that smoldering campfire, and then the inflammation goes up. So the way people are dying from COVID is not because of the virus per se and the infection, it's the inflammation that the body, the reaction of your body to the virus. And so if you imagine there's already inflammation in your body, and now the virus comes in and basically, accelerates that inflammation. Well, yeah, that's when people are going to have all this multi-organ dysfunction, and they're more likely to unfortunately pass away from that. And when you have people who are working nights, who don't have time to cook, who may be stressed out because of financial reasons or family stressors and things like that, that population, those people are going to be much, much more vulnerable because they already had these pre-existing things going on, and then you add this, and it's an explosion. It's like you guys got hit really hard. We got hit really hard in January, December. I mean, my practice is in the office, but they called me into the hospital. I hadn't been in the hospital for 10 years. There were pediatricians seeing adults. There were pediatricians who were treating adults.
There was a meme, I don't know if you saw it, with Gonzo, with the Muppet, and he's wearing a white coat, and he's like, stay in the hospital unless you want to get intubated by a gynecologist.
Pretty much.
Home. Yeah. Stay at home unless you want to get intubated.
Yeah, that was real. I mean, I was rounding with gynecologists and pediatricians, and even I think there was a radiologist who was going around at one point. I mean, we were being supervised by hospitalists.
Yeah.
And so we were running everything by them, so it was still safe. But it was a crazy, crazy time. But remember, 60% of my population is Latino in San Bernardino County. And when this thing hit, the variant or whatever, it just exploded, and it was really unfortunate. I mean, unfortunately, a lot of my, maybe I would say, a very significant portion of my patients didn't make it.
Man, it's tough, man. Hopefully, everyone will get vaccinated, and we'll have a turnaround. Texas will be back, as you say. So, Simran, we're gonna start wrapping up, but I want to have people, if we have this section called dichos de mamá or dichos de abuelita, which is sayings from my mom, and I'll kind of start off. I don't know if you have one from your grandma, your grandparents, your parents, but my mom, just thinking about eating late at night and eating sweets. My mom used to tell me, because I love eating fruits. I eat fruits all the time, and so my mom would tell me, no comas sandía en la noche. So like every before I would sleep, I would always want to get one last fruit, just one more time. And thinking about it, because I loved watermelon especially, and I wonder really if like she had this insight into obesity medicine, because here I am eating this really large sugar load at night, like 11 o'clock or
your mom is a wise woman.
Yeah, and so she was saving me from weight gain. So I don't know if anybody else has these kind of dichos with their parents not, or their abuelitos not letting them eat at night.
Probably the most common dicho, I would think, is cleaning your plate, right?
Cleaning your plate, dude.
Don't waste the food.
That's right.
Especially those of us who come from cultures from in the third world and stuff like that. They didn't say, people are starving in China. They'd be like, we didn't have enough food, like look at all this stuff you have, right?
Yes.
And so that I feel like, we need to do a little bit better with that, because it's more important for you to listen, and this is for everybody, it's more important for you to listen to your body and what your body needs than to try to please other people, especially when it comes to food.
And not listening to your body that like, I need a donut or something like that, right? It's more like listening in a healthy side.
Yeah, I mean, especially when it comes to fullness, right? So when it comes to fullness, if slowing down, right? It takes maybe 20 minutes for your brain to tell you, for your stomach to tell your brain that it's full. So you should take at least 15 to 20 minutes to eat your meal. You shouldn't be like, wolfing it down. But if you do want a donut, I will say this is probably, not the right thing to say as an obesity medicine doctor. But again, that idea of restriction, if you want that donut and you keep telling me, oh, you shouldn't do it. What are you doing? Like you getting in your face about it, you're going to want more donuts. Like
that's good, because I just ate a donut this morning. I ate a donut and a coffee.
Yeah. A donut.
Una donut.
Yeah. So,
and we like to say, si ya donaste, did you donate? Yo doné. Ya doné.
I donate donuts. But yeah, so I mean, if you really want that donut, obviously you got to think about your diabetes, if you got other health problems. But if there's something you want to eat and you're just waving your finger in their face, what's more likely to happen is you'll probably eat 3 or 4 donuts rather than just having 1 or half or whatever. So I think there's more of a movement towards being more mindful and being more like, let's think about what my body needs, because we don't do that. We're always reacting. Oh, I got to make money. Oh, I'm in debt. Oh, my family needs me. I need to take care of my family member over here. This person had a heart attack. We need to cook food for them. So you're just constantly out, your antennas going out, right? Yeah. And not thinking, well, what do I need right now? Right? That principle, because we've lost that, and a lot of our cultures had that in it, right? Like we had that. Most of us in our culture, we had that in our culture to take care of yourself, to be kind to yourself, and to be in balance with yourself and nature and everything else. When it's all about like, more money and keeping up with the Joneses and all this other stuff, we lose that. Yeah. And so that's why these cultures, like Okinawa and like this place in Italy and Greece, and there's one, I think in Costa Rica, Blue Zone, and there's one here in Loma Linda, California, actually, Blue Zone, where people live to 100. These are places where the culture really has benefited them. But the younger generations in Okinawa, the younger generations in Loma Linda, the younger generations, all these, they're not. They're becoming obese. They're gaining weight. They're not living. So it's this westernization, and I don't want to blame any particular culture, but it's this mentality that I gotta make more money. I gotta like have this car. I need to have this. And social media.
Health is wealth. Health is wealth.
Health is wealth. Health is wealth. More money, more problems, as a great philosopher once said.
Can you say the name of your YouTube channel again, please?
Yes.
Let us know.
It's Dr. Murali Weighs In. Dr. Murali Weighs In.
I'm gonna try to. We'll send a link. We'll put the link up on the Facebook page.
Absolutely.
I want to thank you so much. We're streaming live right now on Facebook and on Twitter. We'll have we're on Spotify too, so we put the podcast. You can check us out at Maspons MD on Spotify. And thanks again, man, for making time. And,
absolutely.
Thanks so much. We're trying to do this. We're trying to do this regularly. We're still trying to figure out if it's a live thing or like a pre, not a live thing. So
no, I love to do it. I love to do it, and I love to answer questions too. I mean, I know a lot of people have questions. And
So if you have, so it's on my Facebook on Aldo Maspons. You can. We have comments. I didn't get to everybody, and I want to thank Jesusa Pons Gardner for checking in with us. Rosemary Favela. She asked about intermittent fasting as well. We talked a little bit about that. Blanca Velo, and Pat from Las Palmas. Thanks Pat for watching us. And if you want, and Nicole Apodaca and my suegra, I think, is watching too. If you and Yancy too. Yancy, thanks so much. If you want to, man, you could put in the link there in the comments.
Yeah.
And that way people can check you out.
Perfect. Thanks
so much. All the best, man. See all the best to your family. Okay. Thank you.
Absolutely. Yours as well.